This tropical disease once had a rather global footprint. It was eradicated from all the richer countries, which happened to be located mostly in temperate regions of the world, leaving the tropical and subtropical regions, where malaria thrives better, and also coincidentally where roughly all the poorer countries are located. And here, malaria is yet to be fully eradicated. Let's take the United States of America, for example. Malaria is believed to have been brought to the US by European settlers and their West African slaves starting from the early 17th century, and it continued to spread over the following centuries. By the First World War, malaria had become a major problem for the US military as troops picked up the disease in large numbers in training camps in wetland areas such as Florida. Malaria continued to remain a problem in the US through the Great Depression to the Second World War, where US troops also contracted malaria abroad in the jungles of the Pacific, necessitating the creation of a program for malaria control in war areas. The US tried to fight malaria through a variety of approaches, including medication and going after the vector itself, the mosquito, by eliminating their breeding grounds, which is stagnant water, either by draining them or coating them with oil to smother the mosquito larvae. But in 1939, a game-changing chemical was invented, dichlorodiphenyl trichloroethane, or DDT, and when it was deployed in the US to kill mosquitoes starting from 1943, it immediately tipped the balance in the fight against malaria. Large-scale fumigation campaigns were carried out on acres of marshes and forests. In 1946, the CDC was established with the primary mission of eliminating malaria from the United States, and it went on to spray millions of homes with DDT. This onslaught, alongside other vector control approaches, was so effective that by 1951, less than a decade later, the US was malaria-free. Today, however, employing at least two of those main measures taken in the US at a similar scale would amount to environmental disasters. Coating stagnant water bodies with oil would be akin to an oil spill, and DDT, while effective at killing mosquitoes, is also effective at killing many other organisms and is generally considered toxic to wildlife and has been classified as a probable carcinogen. It is also very persistent in the environment, as for instance, it has a half-life of up to 15 years in soil. Moreover, DDT has been banned in many countries around the world since the 1970s and 80s. Now let's turn our attention to the current situation in Africa, specifically Nigeria, which bears a quarter of the global malaria burden, which is by far the highest of any single country in the world. A large part of the funding for the fight against malaria in Africa comes from international donor organizations such as the Global Fund to Fight AIDS, Tuberculosis, and Malaria, as well as governments at various levels. A large portion of these interventions is in the way of provision of one of the most effective malaria prevention measures, long-lasting insecticide-treated bed nets, with the Rollback Malaria Partnership to End Malaria recently marking a milestone of 2 billion nets delivered worldwide since 2004. In Nigeria, there is a national malaria elimination program, which seeks to coordinate all the efforts towards eliminating malaria. There are also efforts by philanthropists, both at home and abroad, to lead the fight against malaria through a variety of approaches. And then there are research organizations in Africa that focus on mosquitoes and malaria, as well as other vector-borne diseases. At an individual and household level, we have measures ranging from installing window nets in our homes, to the use of insecticide-treated bed nets, to the use of insecticides in the form of aerosol sprays and mosquito coils, as well as liquid insecticides for indoor residual spraying. There are also topical mosquito repellents. And finally, there's protection through clothing, such as by wearing socks and long-sleeve tops or just generally covering up at night. The problem is that these are largely all defensive measures. The mosquitoes are still out there and we are only trying to avoid getting bitten. The nets are probably the most effective, but you are only safe when you are inside them. The insecticides are only indoor measures, as their effect is limited to the treated indoor spaces, which means you are exposed when you are outdoors. Another issue with insecticides is the potential health hazards associated with improper use. It is clear that these measures alone will not be enough to eradicate malaria. To achieve that, we will need to be more aggressive and really take the fight to it. And with all the technology available to us today, this is a fight we can win, and hopefully sooner rather than later.